Welcome back. My next guest is Dr. Wallace Huff, who is an orthopedic surgeon with Bluegrass Orthopedics, whose specialty is sports medicine and total joint replacement, both hip and including hip and knee.
And shoulder. Yep.
And shoulder. Well, thanks for coming in, because I know you're on a schedule. You're actually getting ready to go to the OR here right after we finish this, so I appreciate you doing it.
Thank you. Yeah.
Now, you also told me before we started you have an interest in regenerative medicine. Did I even get that right?
That's right.
Well, tell me what that is and how that pertains to orthopedics.
Well, regenerative medicine is basically using the body's own healing capabilities, specifically stem cells and platelet-rich plasma are the two things that we commonly use in orthopedics. It's fairly new, so there's not a lot of literature on it, but the science has, in the last couple of years, really caught up with the field of medicine, such that we know some things now that we didn't know 5 years ago. And I personally have had very good results in using this in combination with surgery, sometimes to help patients avoid surgery, both in sports medicine type injuries and in arthritic conditions. And I've really been excited about the use of this. I think as the future of medicine plays out, this will become more of a regular part of everyday treatment of injuries, especially orthopedic injuries.
They used a couple terms, stem cells and platelet-rich plasma.
So the stem cells have a lot of power. Your body is constantly regenerating its tissues over and over again. So these are the regenerative cells that basically come from your bone marrow. They also come from fat. Those are probably the most common sources that we can get them from for our use in treatment of patients. But they actually exist all over the body. And so they're constantly renewing your cells as your body tissues are turning over. When you have an injury, the stem cells are deployed in the circulation, travel to the site of injury, and they can basically turn into any type of cell that they need to be, and they sort of act as the directors of the healing process. Platelet-rich plasma is a little different. Platelet-rich plasma, we take the patient's blood and we get the platelet concentrate. There's numerous growth factors in that material, and then we can inject them under ultrasound to a site of injury and basically trick the body into having a healing response, because these growth factors send out signals all over the body to incorporate healing cells that come into the site of injury after they're put into the place where the patient's having a problem.
Well, give me an example. A patient shows up in your office with knee pain.
Right.
Will that help knee pain, and how's the process?
Well, suppose we're going to use stem cells in a patient with knee pain. I see patients every day with osteoarthritis of the knee, and some of them aren't ready for joint replacement or don't need a joint replacement yet there are some activities that they can't perform that they would like to. So stem cells can play a role in helping them get to the activity level that they want to be at. So I will talk to them about that as an option, along with many other options that we have. But that's certainly one viable option, and there's good literature to support now the use of that. And typically stem cells, we'll take them from the bone marrow under a local injection in the office, concentrate them, and then under ultrasound guidance put them into the joint, in this case the knee joint, so we know they're in the right place, and then they'll start to go to work cutting down on inflammation. The arthritic knee is in a cycle of inflammation, so there's all kinds of harmful chemicals being secreted by the synoviocytes inside the joint, and the stem cells essentially shut down the production of those harmful substances, the cytokines that cause pain, and decrease the inflammation, and that may last for 2 to 5 years.
And so somebody who is not a surgical candidate or is not right there for whatever reason, either age, health risk, or whatever, this may be an alternative that might work well for them.
It's a great alternative, and also PRP can also be an alternative for the same type of arthritic condition in the knee. Just doesn't last as long as the stem cells.
That's great information. Thanks for coming in. We'll be right back.